This segment of Delmarva Life is brought to you by Community Behavioral Health.
We just wrapped up the month of September and National Recovery Month to increase awareness and understanding of substance abuse. Many towns on Delmarva marked the month with the color purple.
In Wycomico County, there was even a purple boat parade to raise awareness to the opioid epidemic. September is over. However, the push to raise awareness and educate the community continues, and it should never stop. With us this afternoon, Dr. Suni Jani, who is a Maryland board-certified child, adolescent, and adult psychiatrist with the Community Behavioral Health. Thank you so much for joining us today.
Thank you for having me. Talking
to us about this entire topic of substance abuse. It's just really not a simple one, is it?
No, it's not. It's a complicated brain disease.
Yeah. So let's talk about people. Are there certain people who are at risk? I mean, certain risk factors for addiction?
Yes, and I would say that there's no single risk factor, so there's a lot of different things to keep an eye out for. For instance, if you have a family history of addiction, that suggests that you might genetically be at risk. People with certain mental illnesses, such as depression, anxiety, eating disorders, people with impulse control issues, and also one of the more interesting ones is the younger you try substances, the higher your chance of being addicted to them.
So if I understood what you just said correctly, if you have a propensity to these other things, you might have an addiction problem. Can an addiction problem lead to other mental health issues?
Yep, it sometimes becomes sort of a chicken or egg situation. Sometimes people have a mental illness already and they tend to use certain drugs to self-medicate, which is one way of putting it. And then other times people start with the drug itself and it can lead to a variety of conditions such as psychosis, which involves hearing voices or seeing things, or depression and anxiety.
Now we're watching the use of marijuana and the legal use of marijuana is spreading across the country. Does that mean that marijuana isn't addictive?
Well, I think that is a very common misconception. All the time in my clinic and in many studies, we've seen that there are people who display symptoms of addiction with regards to marijuana. There's sort of two sides to marijuana. There's the recreational use, which a lot of people are trying to get legalized, and there is this new way of looking at it where some people will describe it as medicinal. But there's actually a lot of issues around that still. More research has to be done. You have to try and find a medical marijuana dispensary or an FDA certified product, and it has a very small absolute indication as we understand it in research. It's usually for cancer or HIV related eating or pain disorders and certain seizures, but there's nothing about it with regards to helping mental health conditions, at least not right now.
So it seems like opioids have by far and away been the biggest problem here, the abuse of prescribed opioids. Why do you think that's?
Well, it is a pain medicine. It was frequently being prescribed for pain, mostly because it was important in some healthcare settings for everyone to have a pain rating of 0.
Right.
We know opioids really do have a strong effect, but I think what wasn't recognized in time is that the longer it's prescribed, the more addictive potential it has. So it wasn't being given in short courses or as needed, as indicated. Sometimes people were continuing the prescriptions well beyond what was needed.
Now, sometimes teenagers are prescribed medication after they have surgery, such as a wisdom tooth extraction. As a parent, is there something that I should do or keep an eye on to make sure that doesn't become a bigger problem?
Yeah, so that's a really great question. What frequently happens with teenagers is that they tend to, when they want to experiment, they actually go for opioid medications in their parents' or grandparents' medicine cabinet. So if they had a prescription themselves, I would strongly recommend the parent or guardian being the one to dispense it to them following their pain condition, absolutely giving it only if it's unbelievably severe and they're impaired, and if there's any left over, to try and return it to the pharmacy immediately. Otherwise, I think it's good to keep an eye on some signs of addiction, such as trying to obtain more and more of it, drops in grades, changes in mood.
The question all parents hate, what should we do if we think our child has gotten addicted?
Well, it's not easy. I think it's really important to frankly have that conversation with them that you're concerned. Seek help. It's okay if they don't want to come and get treatment. That is something you frequently see in people that are suffering from addiction. It's okay to make an appointment, try and have them speak with someone. But the good news is that it is a treatable condition and there is hope.
There is hope. Dr. Suni, Jani with Community Behavioral Health, thank you so much. Very good information.